Thank you for the opportunity to talk about something that I've been working with for the past 36 years. My name is Tony Shira. I'm a doctoral level psychologist in Asheville, North Carolina. I began my practice here working at a private psychiatric hospital where I spent 13 years as the director of the psychology service and treated patients on a daily basis, inpatient, and then also treated patients outpatient for a number of years. Since 1990, I've been in a private practice of psychology, treating all different kinds of folks that come in, and treated what would be considered many different kinds of mental illness. In the psychiatric hospital, typically I would be treating patients who had failed to be able to manage their lives effectively outside of the hospital setting and came to somebody's attention in some way. Maybe it was family, maybe it was law enforcement, maybe it was clergy. But because of their inability to adapt their life and be effective in managing themselves, they came to the hospital. Medications were important, therapies were important, the structure of the hospital was important, and the families were extremely important. After that, when I began to treat outpatients, these folks often would come because they wanted something different. They were saying their life was not very effective. They were losing the ability to manage their lives as effectively as they wanted. And so whether it be dealing with emotions that were going up and down on them, or anxiety or depression, either they or a family member, or sometimes the court, said, you need to get some help in learning how to adapt. Typically, the patients and the family are absolutely wonderful to work with because they understand the incredible impact that all of this adaptive ability has on their life. Most people call this mental illness, and mental illness I have a little concern with because it makes us think that there is a way to cure it. And in fact, I would say that most of us have some limitations with how we deal with life, some more than others. If we think of it as being able to offer somebody what they need, whether it be money, whether it be medication, whether it be therapy, whether it be a secure, consistent environment, it's going to take resources to help people and to help them manage their lives effectively so that they can move forward and be contributing members of society in whatever way they can, as independent as they can. When I think about helping people, I guess my greatest frustration ever is the lack of financial resources. These resources are essential to help people manage their lives. I have worked with people who have tremendous resources, whether they be insurance or their own private funds, and it makes a tremendous difference about what we can do for those people. Unfortunately, I've also worked with people who were amazing but had no resources to pay for the services that they needed. I, like a number of my colleagues, do not pro bono work, but we do make people pay something. I remember a family years ago that had no resources, had a number of children, were trying to make it, and they had to pay me $1 per session every time. On many occasions, they would have gotten into the seats of the car and put $1's worth of change in my hand. And it was because they owned, and it was in their control, what they were doing with their lives. My general perspective is treating mental illness is treating multiple systems. All of those systems need our support so that people can have effective lives and so that people can be contributing members of society. I hope that when we think about mental illness, we don't put the stigma on it, that they're bad or that there's something wrong with them. We wouldn't do that anymore for somebody that has gout or high blood pressure. We'd say, well, we'll deal with it. But let's face it, if we have gout or high blood pressure, that's treatment that's ongoing for a lifetime. That's treatment that requires medical care. It requires managing ourselves and our diets. It means managing our exercise. And it means paying for medications that are often expensive. It doesn't go away, but it certainly can come under great control so that we can live our lives effectively. Mental illness is the same. It is only by providing support and care for these people, financial and otherwise, that we're able to help them effectively. I hope that you with NAMI can help that and work towards supporting the people in the Greenville community and work to provide services that are so desperately needed. Thank you for your time.